Okay, so we see the waiting room or the room filling up. Our virtual room is filling up. Thank you so much for those who are already with us. We'll just wait a couple of minutes as the virtual room fills up. Hope you're all having a great day today.
Except for the thunderstorm.
Right. Yeah, we had a bit of that here too. Okay. Well, thank you all for being here. My name is Stephanie Ventura, and I'm the Director of Education with the Ontario Association of Residence Councils. At OARC, our mission is to empower Ontario long-term care residents to understand their rights, share their lived experiences, and inspire a better tomorrow. One of the ways we do this is by working together with our partners to educate the long-term care community and beyond, to build a collective voice and to create positive culture change. Welcome to OARC's Webinar Wednesday, where we explore topics of importance to residents. Today, we are pleased to welcome and partner with Pam Howell from deepprescribing.org. Pam has been a pharmacist for over 25 years in the Ottawa area. Most of this time has been spent working with older adults to make sure that the medications they are taking are right for them. Pam has been lucky enough to work with different healthcare teams at Bruyere Health Hospital and more recently with a virtual consultation service called Jerry Med Risk that connects primary care providers across Ontario with geriatric specialists. In her downtime, she enjoys being a mother of 2 adult sons, a bad golfer, and gardening. She has had the privilege of being part of the deepprescribing.org team since 2018 and is looking forward to sharing how important your role is in making medication decisions. So please join me for our land acknowledgement. Together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we are on today from wherever we are virtually participating in today's webinar. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us, in our own way, can move forward in a spirit of reconciliation and collaboration. I wanted to share with you that on June 21st, next week, we celebrate Indigenous Peoples Day, a day to recognize and honor the history and heritage and diversity of First Nations, Inuit, and Métis people in Canada. This day is an opportunity for all of us to learn about and appreciate the rich cultures and contributions of Indigenous communities. Perhaps there are Indigenous residents and team members who are part of your long-term care home community. Indigenous Peoples Day is a great opportunity to celebrate them and to learn more and to reflect on the ongoing journey towards reconciliation and the importance of supporting Indigenous rights and sovereignty. If this is the first time you're hearing about Indigenous Peoples Day and you're not aware of any events your home has planned, there's still time to work with your home to find meaningful ways to mark this special occasion. The CLRI Diversity Calendar is a fantastic resource that you can use for this purpose. Thank you so much. We can go to the next slide, please. Thank you. So this webinar is being recorded and a copy will be made available on our website along with the accompanying slides. You'll notice that the chat feature is disabled. We do welcome your questions in the question and answer box and have protected time at the end of the presentation for questions, but please submit your questions through the Q&A box throughout the presentation. Anne Donaldson, an OARC board member and resident advisor, will join me in posing your questions during the presentation that we received during the presentation. Thank you in advance, Anne. And without further delay, over to you, Pam. Thank you so much.
And thank you very much to everybody, especially to the OARC organization, for allowing me to have this opportunity to speak to all of you, and to all of you for also taking the time to come and listen to me. So really what I wanted to try to focus on today is about your medications and your choice, and about the fact that really making informed decisions about medications in long-term care can look different for everyone, but there's still important ideas that all of us can take part in, and what does that look like as part of the healthcare team in long-term care homes. And so before we get started, I wanted to give you a bit of context as far as, what I was thinking about when I was thinking about this presentation and what I've learned over the last 25 years of being a pharmacist. So for many reasons, prescribing and taking medications, especially as we get older, can be very complicated. There's many layers to how we use and take medications. And for the most part, it's done very well, helping keep people healthy, preventing diseases, treating ailments. And for many of us, medications are safe, effective, and they help make sure that we live a long and healthy life. But unfortunately, there are times when medications don't do this. I've seen patients that are burdened with taking up to 55 pills a day, or those that are falling or more confused because of the medications that they are taking. And in those situations that are most concerning, I always think to myself, why does this happen? Why doesn't anyone say anything? Why didn't anyone do anything about it? And for the most part, I had a lot more questions than I had answers. But I knew that I could do more to help. And that's why I, really did kind of join the organization deprescribing.org to ask if I could be a part of the solution in 2018. And that's really the reason why I want to keep coming and doing talks like this and speaking with all of you today, because I believe that there are ways we can all make it better. So 4 things that I'm hoping that we can learn about today. First, I wanted to describe how for all of us, medication changes and needs may be different over time. A medication that was once started many years ago might not, might have been prescribed with a certain set of goals in mind. However, these goals might change over time. And as well, there are changes in our body that happen that affect how we process medications, and then also making us potentially more prone to side effects. Secondly, moving into long-term care homes can sometimes mean learning about who are the staff that you can turn to when you have medication questions. It's important to have this kind of understanding when it comes to the process of managing medications, and so we're hoping to touch a little bit on who and how those people are involved. Third, I wanted to discuss that idea and that concept of the shared role between you and your long-term healthcare team when you're making decisions about medications and the things that you're using. Everyone has an important role to play, whether that includes watching out for side effects of a medication or making sure that you tell your doctor or nurse practitioner about important goals and values that you might have about medications that you're taking. And lastly, I want to make sure that the conversations about medications that you have with your long-term care team are as productive and meaningful as possible. So in the last part of this session, hopefully we'll review some tips on how to prepare yourself and how to feel the most comfortable about having those kinds of conversations. So before we start, I wanted to kind of lay a little bit of a foundational groundwork, because I know everyone has a bit of a different concept. So really, to me, when I talk about what are medications, there's many, many different kinds that sometimes people are very familiar with and maybe didn't think about before. So for the most part, people, realize prescription medications are one of them, so such as antibiotics or blood pressure medications. Over-the-counter products are also included in that, so things like allergy medications, cough and cold, headache or pain medications. Vitamin and minerals are also things that we consider. Natural health products like herbals or homeopathic medicines or traditional medicines that you might be taking. And even things like caffeine, alcohol, nicotine, or cannabis are also considered medications because all of these things in combination or in singly can actually affect how your body is working and how you're feeling. So because of that, whenever I do a medication review or whenever people might ask you about medications, it's really important to realize that all of these things need to be included. As well, medications can come in many forms. So all of us relate to medications as far as tablets or capsules. But I also want to bring to light that things like liquids, eye or ear drops, creams, injections, patches, all of those things actually also contribute to those medications. So they can come in really a lot of different forms. Prescribed and taken properly, medications can be pretty helpful. They can be used to treat symptoms that are bothering us or maybe affecting how we live. So a really simple example is something like acetaminophen or Tylenol when you take it to help with a headache. They can also be preventative. So they can help medical conditions from getting worse. And an example of that could be a medication called methotrexate, where this prevents, joints swelling or joint pain from a condition called rheumatoid arthritis. They could also be used to reduce the risk of getting a new medical condition. So an example of this could be taking a cholesterol medication to reduce your risk of having a heart attack or a stroke. At times, the good of medications, unfortunately, doesn't always overcome those potential harms. Over time, there are things that can happen that make the negative effects or risks of medications outweigh the goods or the benefits. And as you can see on this diagram here, there's many of examples of how and when that could happen. So an example could be a medication could start causing a side effect, making you not feel well. This often happens when many medications are taken at the same time because of the way that they interact when taken together, or the way that your body processes them all at the same time. Sometimes other negative effects for some people is the thought of taking so many medications. So are they burdened by the fact that there's just so many pills and that they're inconvenient to take, or that they have to have a lot of medical tests because of the fact that they're taking so many. And so that's when those risks or those harms, really are not potentially worth those benefits. Another layer to complicating things is the fact that as we get older, unfortunately, things just aren't working as well as they used to when we were younger. And a lot of us can probably associate with that, even myself. But in particular, when it comes to medications, we think about a few certain things. So one is the fact that our brains become a little bit more sensitive to drug effects. So medications that may have been okay for us initially when we were younger may start making us maybe feel a little foggier in our minds, maybe causing a little bit more dizziness than usual. And those effects can actually be increased, especially when you take more than one medication that causes the same kind of side effect. The other idea is the fact that some medications can stay longer in our body than they used to before. And so they start to accumulate, or your levels of medications in your body are higher than they used to be. So that can lead to increases in side effects and feeling awful when you're taking them. The other problem that unfortunately our body does is the fact that our liver and kidneys don't always work as well as they used to. And because they are the ones responsible, or the organs responsible for removing medications many times, if that isn't happening, then it can also lead to higher medication levels in your body, and obviously some maybe higher side effects that you may not have had when you first started them. What this really drives home is the fact that what medications might have been good for you or a good choice in the past might not be the best medications or good choice now. And maybe the reason why having a medication review is something you might want to think about, or why your care team is actually looking to review your medications. The other part or other side of the coin to medications is the fact that our goals, with our health can change over time as well. When we were younger, we might be looking at the fact that we want to prolong our lives for as much as we can and keep ourselves healthy. And that could look like, trying to make sure that we have really strict blood pressure controls or blood sugar controls. But maybe as we're getting older or finding that really we're looking for quality versus quantity, we could kind of say, well, maybe these medications aren't really worth it because of the fact that the lower my blood pressure is, the more I feel dizzy and the more I'm feeling like I could fall. The other options too, sometimes with our goals, is the fact that, preventing something that could happen to us in 5 or 10 years, like a heart attack or a stroke, may not really be worth taking as many medications anymore. Whereas maybe taking medications that help our symptoms right now and help us feel good, like, making sure my pain is well controlled, is more important to me at that point, and is why I might want to continue those kinds of medications. And when I talk about medication changes, that could look like a lot of different things, depending on what your goals are and all of those other things that we talked about. In many cases, having to take medications, and many of them could mean that you need a lot of blood work or tests associated with them. Sometimes you might feel like all you're doing is, taking a lot of medications. And so sometimes it's a good opportunity at that point to think about, are there non-essential medications that we could potentially stop? So this might be things like vitamins or minerals or natural health products that you might not need anymore because you might not be deficient in those nutrients. The evidence really isn't that strong, or there are other ways to kind of manage the symptoms that you were using those pills for. There are also certain medications that could be impacting things like memory or your increased risk for falls. So at that point, when I do a medication review with my patients, those ones are the ones that I like to kind of try to prioritize to see whether there's changes that we could do with them. So whether that's reducing them or, are they still needed? Like we had mentioned, for some people, keeping medications that manage your symptoms that are important to you. So whether that could be pain or shortness of breath, or if you're feeling nauseated or have a stomach upset, those medications may be good to keep. Or if they're no longer symptoms that you're worried about, then are those opportunities where we can look at reducing those medications. Another option, or sometimes, issues that people have with medications, is that they have trouble swallowing them. Instead of struggling with that, there are a lot of options to be able to give you medications in different ways, whether that's through a patch or maybe an injection. And as well, are there options to maybe help with the swallowing of those pills, whether they could be crushed in certain foods or given with fluids or, other opportunities. And last but not least, like I had mentioned before, it's that goals of care. So what is important to you? And so that kind of option to discuss, what do I want out of my medications? What are my health goals? And are those medications that I'm taking right now really treating those and, and reaching those goals for me? And when I talk about, medications and reducing or changing them or stopping them, it's a concept of something called deprescribing. And I don't know if any of you on the call have heard of this word before, but I did want to kind of bring it to light that it is an option or an idea where really the goal is to maintain or improve your quality of life while reducing the medication burden and the harms that could be associated with them. So really, it's a planned and supervised process with your healthcare team, where you're looking at backing off when doses are too high or stopping those medications that are no longer needed or could be causing harm. And really, as a pharmacist, I always look at it as this kind of option is not about giving up or the fact that, we're saying that all medications are bad, but it's kind of that part of good prescribing. So as much as we start medications, it's also a good idea to look at what can we stop. And so when I talk about a medication review, really when you move into long-term care, there are several opportunities for medications to be reviewed. The when it happens, how often it happens, who's involved, and the process can look different depending on each home. But there are some key themes that I wanted to kind of bring to light and are important to know about and what I really want to touch on next. So essentially what a medication review is a critical examination of all scheduled or as needed medications that you might be taking. So the goal is for the healthcare professionals or the healthcare team and yourself or your substitute decision maker to agree on a few things. First, the treatment plan. So what matters most to you? Making sure that each medication has a reason for use, that it's helpful, it's appropriate, and that it's being used effectively and that you're not having any problems taking it. Identifying and resolving any medication-related problems that could be related to side effects or challenges with taking medications. And also looking at the opportunities to stop any medications that no longer fit your goals or are causing more harm than good. And so when do medications get reviewed in long-term care? So there's a few different opportunities. And so those 4 different points look like this. First, when you're moving into long-term care, the care team goes through and reviews all of your medications. And this care team could include the nurse, the doctor, the pharmacist. And what they want to do is make sure that they have a very complete list of all the medications that you were taking before you moved in, and making sure that that's documented in your care plan appropriately and that things are prescribed appropriately. They may do this in a few different ways, whether it's contacting your community pharmacy before you move in, and also talking with you or your care partners to kind of get an idea of exactly what was happening at home. The other times that medications can be reviewed are in care conferences. So that first care conference usually happens within the first 6 months of moving in, where your care team has the chance to review your medications with you. And really preparing for these kinds of meetings with any medication questions or concerns can really help the care team know about how best to make good decisions about continuing, stopping, or changing your medications. There's also those follow-up care conferences that happen at least once every year. And those are a great opportunity to then bring up any new or outstanding issues that you're worried about with your medications, and follow up on any decisions that maybe you had made previously about medication changes. The third point is really the quarterly medication reviews, and that usually happens within your care team every 3 months. And so it's that point where the care team will identify if medications could be changed, continued, or stopped. And really those points too, if they are making any changes, should be the time when they will be discussing with you before making any final decisions. And then lastly, it's really when something changes. So if there has been, something in your health that has really triggered concerns with any medication side effects, so whether that's after a fall or a discharge from hospital, is usually another point where the healthcare team will look at medications to see whether there's any potential for stopping or reducing doses because of the fact that they could be impacting your health at that point. And so how can you be involved? Because obviously a lot of the times everyone says, oh, Pam, well, I'm not a medication expert. Why should I even think about all of this stuff? And I think that there is really important parts that you can be involved with. And as you can see here, I think the first responsibility or the first ownership that you can take is investigating. If you haven't already done so, get to know how medication reviews happen or work in your long-term care home. As I mentioned, each long-term care home has a slightly different process depending on the staff or when they're present on site. So your discussions could look different if it's during an evening or on a weekend versus during a weekday. The long-term care home might prefer that you discuss things with your nurse first if your doctor isn't available, or even knowing your medication review schedule will help plan, for anything you might want to ask or know about. I think you have the opportunity to advocate for yourself. So voice your interest in being involved and kept up to date with medication changes if that's important to you. That can look different for everyone. Some people want to be totally involved. Others want their care partners to make those decisions. Others feel like they don't really care. So there's a really wide gamut, but I think it's appropriate, or at least important, to make sure that the care team knows how much or how little you want to be involved in medication changes and those discussions. This can then be documented in your care plan as part of the communication to the whole care team, and then they can use it as future reference. I think it's important for all of us to also be prepared. So understanding your medications can be complicated, especially if you're, prescribed several different ones. I think the pharmacist can be a very good and reliable source of medication information. And I realize that they aren't always on site, but there's always ways to be able to access their services. It just depends on the long-term care home. So, trying to find out what the contact information is, who you can talk to, and when they're accessible. The other options are thinking about if, asking about when it is best to talk with different staff. So this could depend on their schedules. And the reason why I bring that up is because there's nothing more frustrating, for you, when you're feeling rushed or not listened to. And so knowing when the staff have a bit more downtime or what the doctor's visiting schedule is can really help make sure that your conversations happen in a timely manner and without distraction. And especially because you want to make the most of the time. And have the opportunity to voice your concerns in a safe space. Being prepared with exactly what you want to talk about, can help make those conversations more efficient. And as well, unfortunately, if there's only limited time, think about what priorities you might have or the things that you might want to think about, first talking about because they're important for you. And then give the team the heads up that, you have concerns in advance. And so that way they themselves can also prioritize and feel like they can give you the best information at that point too. So I always want to say that conversations, to make sure that you're on the right medications require communication between all members of the care team. And so it's really not surprising to see that there's a lot of people that are involved in that, whether it's a nurse, whether it's your nurse practitioner or doctor, whether it's your pharmacist, whether it's your family or care partner. But most importantly, what I want to show you is the fact that you are at the center. You are the most important person. And the reason is this, is because of the fact that you are your expert. You have lived these experiences. You know you better than anyone else. And so medication reviews are really about sharing both sets of expertise. And so from a healthcare professional's perspective, we have excellent knowledge of the benefits and risks of different medications. But it's important to really remember that we rely on the experiences of you who actually take those medications to help us make those decisions together. So the more we know about a person's history and experience with medication taking, the better decisions we can make together in your best interests. If we are, as healthcare professionals, become aware that maybe things like you think that you might be experiencing some side effects with your medications, or that you don't like taking medications, or you don't like taking certain medications, or if medications are prescribed, what health goals do you want to make sure that they help you with? So sharing all of that that information can really make sure that we have better discussions, make sure that that results in better care and safer medication use. And this whole idea is something called collaborative care or shared decision making. And when I talk to people about their medications, they're really sometimes surprised by how important I think their opinions are in deciding if a medication should be started or stopped. We as doctors or pharmacists may be experts, but you know what? We really do look at the fact that you are experts too. And so hopefully I can drive that point home to everybody before the end of this presentation if I haven't already. And so when I talk about the fact that you're a very important part of the team, as I mentioned, your role has a few different things to think about. So you can be the one providing details about your medication history. You can decide what matters most and what goals of treatment look like. And you can also be the one that helps, report new symptoms that could be a problem that maybe we aren't aware of. You can also help with answering if medications still meet your health goals. You could help identify medications that you think or question whether, do I need them or could they be deprescribed? And identifying those side effects with starting of a medication really is helpful, whether we want to actually stop them or if maybe they're actually causing more problems now than they were before. And so who can I talk to about my medications? You might be surprised to know that there are many people in long-term care that are key players in making sure that your medications are safe and effective for you. Often we think of those obvious ones. So our doctors or nurse practitioners, because there's the ones prescribing the medications, our pharmacists, because they're the ones providing or dispensing the medications, and our nurses, because they're the ones that help you take your medications. All of these team members have the knowledge about what medications you take, what side effects could be happening with them. They help monitor whether medications are working or not. And finally, they're the ones that you can ask medication questions to. But did you also know that there's other people that are part of this team that you might not have thought about? So people like your personal support workers or care aides are also important members of this team because they may not know details about your medications, but they spend a lot of time with you and may actually know you best. So they're always keeping an eye on you to see if something has changed, even if you don't notice them. So sometimes these changes could be related to medication side effects, and they are the ones that could bring it up with your nurse or your doctor. As well, they can also bring any of your concerns or questions up with the nurse or doctor or pharmacist on your behalf if you maybe don't feel comfortable doing so. Another important person in this team can sometimes be your social worker. They can help you navigate your medication questions or discussions with the care team, especially during conferences. They could help you get ready for having those medication discussions. And they can also help you navigate things like costs of medications, especially if that is quite a concern for you. And so the next thing I want to kind of do is take that deeper dive into your role as part of the team. And what can you do to help yourself feel prepared? So having a good medication plan can give you and everyone on the team that peace of mind of knowing that decisions are being made with your best interests. So being asked to make decisions can sometimes be very, daunting or something you've never thought about before, but it doesn't need to be scary or impossible. A little preparation can go a long way in having a successful and meaningful discussion with your team. So hopefully I can give you some tips over the next few slides. So the first step that I always say is the important part is to make sure that you know which medications you're taking right now and to have an understanding of what they do, be able to track your experiences with them. And this can offer helpful details for the care team as well to make decisions on what to do with that drug next. There's many different ways to keep this kind of list, in your files. This one here that you see from deprescribing.org is something that we've created as a template to help you write things down on your own and be able to keep track of everything. So it is freely available, and I will be providing links to many of these resources and tools after the webinar that Stephanie has so graciously offered to share with all of the attendees and registrants. So when I think about important, details or pieces to the puzzle that you might want to think about, might be things like keeping track of dose changes or the reasons why you're using them. Potentially maybe what medications have been tried for certain conditions in the past, but that you're no longer taking because of a side effect or that you didn't think they worked. Any kind of allergies or intolerances to medications that you know about. Medications potentially that you feel like have helped, or medications that you're really worried about whether is it causing me a side effect, or what kind of side effects could it be causing. So for various reasons, the long-term care team members, really tell us that it can be very challenging, to kind of find that information, and unfortunately it doesn't always, follow you when you are moving into a long-term care home. And so the more information you can even provide to them, the more that the care team will feel confident about the care that they can provide you, and that they can also help guide you making right decisions when you're changing your medications. If anything, there's also a couple of other links here. So this poster and video from the Canadian Institute for Safe Medication Practices goes through common questions that help remind you, of what you want to ask when you're reviewing your medications with your care team, and also provides a little video. So a lot of the times these questions happen when you start a medication, but you can also really apply that to medications that you're currently taking. So asking about, well, what things should I be watching for? Who should I tell if I notice a change? I would want to know not just about what bad things potentially could happen, but also what good things I should be expecting if, I continue on with this medication, or if it's being stopped. Other medication information resources. I know there's a lot of out there, especially a lot with Dr. Google, but we do want to encourage everybody that, you need to kind of make sure that any information that you get is something from a reliable and trusted source that's going to give you correct and up-to-date medication information. So your healthcare provider is your first and foremost, obviously your doctor, pharmacist, or nurse. One really reliable resource online is something called Medline Plus, if you're looking for just general medication information. And just general tips is looking for the fact that, is that information current? Is the information the same if you check another resource? And as always, beware of those television, radio shows, and commercials, because unfortunately that information is not always the most accurate, and can be very misleading. As I mentioned before, everyone plays an important part as well in watching out for and reporting side effects of medications. So when you are the person taking them, if you feel like something is, affecting you, or if you're having symptoms that maybe you had not before, or that you're really wondering about, a question could be to yourself is it one of my medications that's causing this? And as you can see here, this poster that we've created from deprescribing.org kind of goes through a lot of the list of symptoms or side effects that could be related to medications. And so, linking those back to some of that may help those discussions that you could have with your healthcare team about what medications should you continue with. And so back to that shared decision-making idea, it's really understanding the options, reaching choices that fit your values and preferences, and making that best decision for you. So that could be based on a lot of different things. And, one example could be what does the research show about how the different options work? That best decision could be, well, what side effects are acceptable to me and not acceptable? There could be that conversation about what other things might be going on with my other medical conditions that are more important to me than treating it, this other little simple thing. And as well, what do you value as necessary to live that full and healthy life with whatever time you have left? And so these conversations are especially important when trying to make those decisions, when there's a lot of multiple options, because all options have trade-offs, and the decision depends on a person's, willingness to accept or not accept, when maybe the research isn't clear, or those side effects maybe are more harmful than good. And so participating in shared decision making has a lot of different components. So the questions that you might want to think about asking your healthcare provider or healthcare team is, what are those different options available? Are there non-drug options that I could think about? What are the risks of each of those options? What benefits do each of the options have? And what happens if maybe we don't change anything right now? So if I stay status quo, what are the risks to even that? And then questions that you want to ask yourself that are important to kind of discuss with the healthcare team are, like I said, the goals. And really, do I feel like I'm ready to make a decision now, or would I like more time to, or information to make that decision? And that's okay too. Even though they may be bringing up these ideas with you at this point in time, it's okay to say, okay, I just need a little bit more time to think about it, maybe discuss it with my family members, maybe do a bit more research and reading as far as, what are those risks and benefits. And so, kind of bringing it to light that you have that, power to be able to say, I need time. And so making that shared decision making, here's another little tool that we've created on deprescribing.org that kind of gives you those prompting or cues about having those shared decision making conversations. So the steps here, you can see that there's 5 of them, as we talked about, considering that decision needs to be made, sharing your goals and preferences, asking about those different questions, whether they're the benefits or the risks. Feel like you understand each option, and make sure that you're asking questions if you don't. And then help everyone in the team make an informed decision about the medication options. And as well, there's no reason why that if you decide later on to change your mind, you can do so too. And then the back of the cue card that you can see here, the page, kind of gives you those few options as far as what kind of, starts to those conversations can you have. How can you phrase your questions, or how can you feel confident about asking those questions? So I do want to acknowledge that as much as I've been saying, have these conversations, go ahead and do it. I do want to acknowledge that, conversations are not easy and sometimes scary if you don't know the team well, or if you feel like you don't have all the information. But I do want to let you in on a little secret. Many healthcare providers also feel the same way. Not many of us have formal training in how best to have these conversations with you. We worry about losing your trust or making you feel like we're giving up on you. There may even be a time where you may not agree with the care team's first choice option, which can then make things very uncomfortable or awkward. But just sometimes a few mindful steps can at least make this road a little less bumpy. So don't be afraid to take that first step. Or there are a few phrases in the bubbles here that, I tried to give as, takeaway ideas for how to start those talks or those conversations. Offer your healthcare team members time to prepare if you really feel strongly about reviewing your medications. See if you can make an appointment. Find out how much time you have to have these conversations. And make sure that all the right people can be there and give the team a good idea of what you want to talk about. Also, be flexible that you may have to have these discussions over time. You may be able to only go through 2 things on your list at the first meeting. So prioritizing what's important to you at that time, and giving healthcare providers that opportunity to say, okay, well, let's revisit things in the future if there are other things that you're worried about. And healthcare providers might not have all the answers right then. So, being mindful of the fact that maybe they too may need time to be able to make sure that they give you all of the right information. If either of you, whether it's your healthcare team or yourself, don't feel 100% about the decision that you make, there's always opportunities to plan for how and when you can revisit things, and keeping it open to know that the plan might change, and that the care team is there to, offering you help where you can, and, appreciate the fact that you want to be involved. And so ultimately, I think it's really important to remember that everyone has your best interests at heart. So I think it's really just trying to find the best way to help navigate each other to make sure that the end goal is really keeping you safe with your medications and making sure that you get the most out of them. And so my take-home points, because I think I've come to the end, and thank you very much for the time, are one, medications should fit with what matters most to you. Two, as you get older, medications can start affecting you differently. So it's always a good idea to review them regularly, reducing medications that you don't feel are needed any longer or maybe causing more harm than good. Safe medication management is always a team effort. So decisions should be shared, and it's an agreement between you and your care team. And four, ask your care team about medication reviews and how you can be involved. And obviously there are tools available to help you feel prepared, and hopefully you are able to peruse them and use them in the future. And so with many thanks, I'm going to kind of close up there and hopefully maybe there's some questions I can help with.
Thanks so much, Pam. This was such an informative and just I'm a little bit speechless with all of the things that I've learned. And this isn't the first time that I've heard you speak about this. And I've learned so much. Had never considered how, as you get older and your body changes, the way you respond to medications, even some you've been taking, for many, many years, might also change.
Well,
Thank you for mentioning that. I also really appreciate how you recognized and validated how difficult it might be for some to have these conversations, and also that not everybody wants to be involved in the same way with their medication reviews. So letting your care team know what you're comfortable with, how you would like to be involved is a good first step. I don't see any questions in the Q&A, but we'll give people a few moments. I think Anne might have some questions.
I just wanted to confirm, Pam, you are working within the long-term care home area?
So I have so because I work virtually with our with my Jerry Medris team, we do often get referrals from long-term care homes regarding medication reviews or other kind of issues from that perspective. I have worked with geriatrics, and older adults, in my 20 years of hospital career. So definitely, I am appreciative and acknowledge the fact that things are complicated when it comes to medications. And with a lot of the deprescribing.org work that I've done since 2018, a lot of that has been engaging with long-term care partners, whether it's OARC, whether it's FCO, a lot of clinicians and nursing organizations and partners across the province, kind of looking at what does medication management look like in long-term care. So a lot of the resources that I identified that we've created are because of that work. And the fact that we are hoping to empower residents and care providers to have better medication conversations, because that really was a gap that was identified as to why people continue on bad medications or aren't having the most optimized kind of medication regimen. So, these little tools we're hoping to kind of give healthcare providers, long-term care staff on front lines opportunities to, start those conversations and realize that they are a part of that circle of care.
And did we, we kind of touched on this before we started live. Um, it's gone right out of my head as you mature. Sorry, that's just right out of my head.
I usually
Um,
plug my ears so it doesn't leak.
I've got earphones that didn't stop it. So I'll ask another thing I was thinking of. We can allowed to speak. Oh, I know what it was. Can people get in touch with deprescribing.org with a question or a comment or a suggestion or an idea?
So, so definitely, if there's something big picture, we as an organization try to take that into account with a lot of our work. Unfortunately, when it's personal medical information, we
Okay.
can't, just because of the fact that we are not within that circle of care and do not have access to all, a lot of the medical information,
Right.
medication information. So there is a limitation with our services from that perspective. And so a lot of the times, I always encourage everybody to use the avenues that are already available to them if they possibly can, and looking to whether, like I had mentioned in my talk, who are those people that you can talk to, your pharmacists, your physicians, and your nurses. And like I said, I do realize that in long-term care, they're not always there every single day or physically there. But hopefully maybe, with a little investigative work, you can find ways to be able to still connect with them, because they are there. They may not be, they may not be there physically, but they still have to be there in some capacity. So building those relationships that way are your, definite first steps.
Okay. Thank
Yeah,
you.
that was a really good point about investigating, finding out how it is that your home does things. And you mentioned, Pam, that each home might have a different process for how medication reviews happen, when they happen, who's involved. So finding out firstly if, how that happens in your home. One way you could do this, if there's a collective interest in this at your home, is through your residence council. At your next residence council meeting, you can mention this webinar and the information that you learned through it, and maybe start asking some of those questions at the council. Invite your pharmacist or your nursing, a member of your team, to speak
Yeah.
to the residence council and provide some information about what process your home follows.
I
Absolutely. Yeah.
I have found that um, one of the options you said was speaking directly to the pharmacist. I have
Mm.
found that here, and I don't know how other homes work, but I have found that the pharmacy we use is very, I'm going to say, difficult to talk to,
Okay.
because it's like, why are you talking to me? You're the resident.
Mm.
like like I can't talk to you type thing. Well, yeah, in fact you can. It's my name on the prescription. But
Yep.
I get that kind of pushback, and I don't know whether it's just my home or whether it's something to do with long-term care. But I think it's wrong.
And Anne, I think that, you bring up the point that, I think what we need to do then at that point is, maybe say that it's maybe the person that's on that phone that's picked up with you is not the right person. So is there an actual pharmacist that's involved with,
Yeah.
taking care of the medications at your home? Could you book an appointment
Mm,
with them to speak to them, because this is what you hope, to accomplish. So then that way it's a focused kind of discussion. And
mm,
it gives the person on the other end time to prepare, and make sure that when they are speaking with you, like I said, it's efficient and it's effective for you too, and you're going to get the most out of it. And so that hopefully might, alleviate some of that frustration, or some of the, the pushback that you're feeling too.
So what you're saying is just keep pushing on, because
Yeah,
eventually to keep going is keep asking for somebody else to speak to until you get to somebody who will actually speak to you.
who knows? And if the pharmacist is not the, the option, are there other care team partners? So
Yep.
obviously the nursing staff are still there that, you can kind of help speak to if there are certain particular questions you might have. If they don't know, maybe they could be the liaison between you and the pharmacy team to find out those answers.
mm.
Is your doctor or nurse practitioner another avenue? And in the same capacity, if those questions or concerns are something important, can you write them down, so then that way, the doctor and nurse practitioner
Right.
have time to prepare, and then speak with you in a certain time
Yeah.
frame. Yeah.
Yeah, that's a great point, Pam, and thanks for mentioning that, Anne. Anne, can you just let us know the number that you're calling? Is that the number you're seeing on your monthly bill that comes in? Um,
Yeah, I've only ever called it, I think, once
yeah.
or twice, but I've gotten absolutely
Mm-hmm. Yeah, so it might be
Stonewalled.
it might be a
It's
big,
none of your business. Well, yeah, it is. Sorry.
yeah.
And so
Yes.
maybe there might be an actual particular pharmacist attached
Mhm.
to your long-term care home that the care team knows about. So they may actually have a phone number that they communicate with that is different than what you might be seeing on other information. And so that might give you an easier avenue. It is frustrating though that you would have wished that they would have been able to direct you within the organization. But you know, sometimes we end up having to be our advocates as much as we possibly can, and you know, kind of pressing on.
Yeah,
Yeah,
it's
that's
just
a great idea, Pams. If you're watching this today and you're thinking, oh, does my home have a pharmacist who works with us? That's another great question that
yeah,
can
it
be
is.
asked. Yeah, just what is the name of our pharmacist? How often do they come into the home? Can I speak with them directly if I'd like to? Can I book an appointment with them? Great idea. Thank you.
Are they supposed to come into the home?
So they may not physically be able to, Anne, but they do have a lot of them do have remote access. So I know that that's you know, that model of care since COVID
Right.
has definitely evolved, and the capabilities of being able to do that. So once again, every home is a little different, and so finding out what that process looks like for your home is another important piece.
It's an interesting suggestion or comment because I've never asked that question if they come into the home.
Yeah.
Yeah. Well,
But
I
they
don't
could.
think.
But they could, is what you're
They
saying.
could, yeah, if they're working locally, they, you know, there's definitely that
Oh, okay. Yeah.
opportunity. Yeah, so
More,
that's
yeah.
yeah, that's for sure.
Which would
I
raise,
s-
sorry, I was going to say, which would raise another question about the locally, that we have one person who's lives in Brockville and he has to get his medications from, like, what is it, Montreal? Where are they
mhm.
ship it from?
Maybe
Somewhere.
from Kingston.
Yeah, Kingston. And that to me is just, well, that's just wrong. It's not like Brockville's a neighborhood store with or a place with nobody there. It's a big
Yeah.
place.
And so that's, you know, those kind of navigating, you know, finding out exactly how your pharmacy system works, you know, can definitely help identify, okay, well, you know, how do I actually ask those questions, or who
Yeah,
is the person that I should ask? Because where your medications come from isn't necessarily as important as who, you know, who can I talk to about my concerns? And that kind of thing. So I think it's more the who that
okay,
if you, yeah.
okay.
Okay. Well, thank you again so much. I'm not seeing any more questions coming through the Q&A. I would just like to say thank you again so much, Pam, for all of this wonderful information that you've
Yeah,
shared today and the further information that the registrants and participants can look forward to receiving, those links to some of the templates that you mentioned, the conversation starters, great stuff from
yeah.
deprescribing.org that'll help you have those conversations in your home. Thank you, Anne, for being a co-host here with us today. And thanks to all of you for being present and for being engaged in this presentation. If you could please take a couple of moments to fill out the evaluation that will pop up on your screen when you click the X, when you close the screen, we would really appreciate that. Um, Thank you all so much. Have
And
a
thank you, Pam, again. Thank you,
Thank you very
Stephanie,
much,
for hosting.
everybody. Yes, thank you very much, everyone.
Okay,
Thank
Okay,
you.
bye now.
bye.